Hi, everybody, and welcome to Behavioral Psychology here at Colorado Christian University. This video lecture will be going over behavioral data graphing. We're going to be talking about how to collect and then visually represent various types of behavioral data. So as we're implementing interventions, we're going to want to be able to find a visual way that we can show the information that we're getting and truly see on paper and in front of our eyes is what we're doing working or not. And this will be relevant in a variety of different fields in psychology. So this can be used in workplace, evaluation of behavior and progress after intervention. This could be used, with yourself as you're working on developing new habits, establishing new behaviors, and using those interventions. So perhaps with a weight loss or exercise program. You can also graph behavior to record the effectiveness of interventions with others in, even a family or a parenting setting and see what's working. As well as in the culture at large. So, for instance, you could graph the behaviors of consumers after a certain marketing technique was used in advertisement. And this would help you to understand if that was working or not. So keep all of these applications in mind. By the end of the video, we're going to be able to identify major components of a graph. That's something that you may have reviewed in previous coursework. We're going to be able to define terms like phase line, phase label, baseline in a graph. And then you'll also be able to interpret or even create, if you needed to, an AB or an ABAB graph displaying behavioral data. If you're provided with data, you'll be able to do that and to read those graphs and understand what they're saying. Finally, you will be able to work with multiple baseline graph designs, alternating treatments designs, and changing criterion designs, all different kinds of graphs that we're going to be able to look at. And you would be able to read and interpret those or even create them yourself as well based on the info that you'll obtain in this presentation. So first, some reasons for the need to graph behavioral data. This will give us a visual representation of what we're doing and whether it's working. This can be shared among providers. So if you're a behavior therapist or a clinical counselor, you might be able to meet with colleagues or with supervisors and say, here's the data, here's what's happening since I've implemented this intervention. What do you think? It can be helpful for consultation and really showing what's happening instead of having to try to describe it verbally. Can also be disseminated to some different stakeholders. So depending on the setting that you're working in, you could share this with spouses of a client, the spouse of a client, parents or guardians, schools, care providers, anybody. It could be a physician or a medical provider, anybody who wants to know how is the intervention going. So that could be used in a variety of settings. Painting a picture of progress or improvement. So really being able to take a good look at what's happening and what's working or not. And then in some cases, you could even show this data to the client if it's a situation where that's appropriate. So saying to the client, hey, we've used this intervention for 30 days and here's how we're doing now. This is what the data looks like. So helping them to evaluate after you're done with the intervention what the progress looks like. And that can be motivating or inspirational to some people as well. So keep in mind the x-axis is that horizontal axis. We've got the y-axis going up and down, and all of these are going to have units as well as labels to describe what they're representing in your graph. Each data point is going to be a measurement at a specific point in time, demonstrating the level of the given variables. So for instance, if we're looking at the occurrences of raised voice as a behavior, a person losing his or her temper through raised voice, then we're going to have points there identifying how frequently that's occurring before and after an intervention. Next, we'll have phase lines. So we need to understand as we're looking at an intervention, and we have a visual on the next slide, that the phase line shows where the change in treatment occurs. So down at the bottom, you'll see that baseline is a term that we use to say that no treatment has been introduced. Let's say that a person is struggling to quit smoking. The baseline would be without any intervention, how frequently are they smoking a cigarette? And then the phase line would show that the intervention has begun. And that intervention might be the use of a nicotine patch or gum to reduce the behavior of smoking. So the phase line shows when that started. And then the phase label after the baseline, phase line, the phase label would be treatment. So you could say, patch or gum used to reduce the smoking behavior. Phase lines can happen from no treatment or baseline to treatment, treatment back to baseline, treatment to a new treatment. All of those will be indicated by phase line, changing what treatment is being used. So here's an example. All these examples coming from the Miltenberger textbook, except for one on a slide with a different reference. So we've got the x-axis here as days, and then the y-axis is the hours spent studying. So we can see that this graph is showing how frequently this person, or how much time this person is spending studying on a given day. Our baseline is right here. We see that they're studying 1 hour, no hours, 1 hour, not a ton. And then our phase line there, that dashed line, shows that we've put into place a behavioral contract. The person with a therapist, counselor, advisor, perhaps, and the intervention then shows a large increase in number of hours spent studying. So we've got 2 hours, 3 hours, back down to 2, and now we're up here at 4. So we see, by the way, that it appears that the intervention is working just based on what we have here. But do keep in mind that there is no functional relationship demonstrated in an A-B design. So A would be that baseline, B would be the intervention. We see an A-B design example here. So we're looking at this and understanding then that this is not a true research design. And the reason that I say that is it does not test the treatment or implement the treatment more than once. We would really want to do that at least 2 times, if not more, to see if there truly is an impact. Because right now, it could be any variable that's affecting. Here's this other example. We have disruptive behavior on our y-axis and the number of days that have passed on our x-axis. We see that praise, or verbal positive reinforcement, has been introduced as an intervention after this phase line right here. And so the baseline disruptive behaviors are higher, and then we see that it appears that they're significantly lower after introducing the praise intervention. But we don't know, based on this A-B data, we don't know if the praise is the reason that the disruption is decreasing. There could be a variety of things going on, such as the person's getting more sleep, the person is having fewer relationship problems. Any of these things could decrease the frequency. So we would really need to pull back on the praise and then implement it again later to see if the relationship really is there. So what we would use for that, by the way, is called an AB-AB graph design, and this would be an extension of the AB. Okay, so if AB is baseline treatment, then an AB-AB would be baseline treatment. Removing the treatment, so back to the baseline condition, and then reintroducing the treatment to see what kind of relationship really is there. We may be evaluating more than one treatment, so think about A being no intervention, measuring how many cigarettes are being smoked. B is the use of the patch or the gum as an intervention. We're seeing that it's really not working. So then C, a second treatment, could be, some kind of mindfulness therapy to reduce cravings. Back to A, we'll do the baseline, no treatment. And then C, we could reintroduce that mindfulness intervention, showing A, B, C, A, C. So that B treatment's not coming back because we saw that it wasn't helping. That's what that design might look like. So there are many different variations that can be used here. We do want to think about whether it's ethical to remove treatment. If the baseline behavior is dangerous, for instance, self-harm, the treatment that's introduced could be, positive affirmations to improve self-image. And if we remove those positive affirmations from the provider, we then could end up back in a place of self-harming behavior, and that could be unethical. That could be dangerous. So if it's working and the behavior is dangerous, we want to keep doing it, and then we can introduce some other interventions, perhaps medications or other supports on the side. Will the behavior reverse when the treatment is removed? Sometimes it does not, and especially this could be the case if the treatment is something that's being taught. So in the example above provided for mindfulness skills training to reduce cravings in trying to quit smoking cigarettes, can you really pull away that training letter C? Can you really take away that mindfulness intervention if it's already been taught? So that could be an issue with the design here. Here's an example of that AB-AB graph, which also is included in your text. So here, by the way, we see that the demands definitely do increase the aggression. It's quite clear. Multiple baseline design, there are 3 different types that are covered in your textbook for Miltenberger. So we've got multiple baseline across subjects. That's when the baseline and the treatment are for the same target behavior, but there are multiple participants. Multiple baseline across behaviors, we've got baseline and treatment for 2 or more behaviors with the same person, looking at multiple behaviors. And then we have multiple baseline across settings. So we are looking at the same behavior and the same participant, different settings like home and work, for instance. Examples of these would be multiple baseline across subjects. The example from the text is, we can see here on the y-axis, this is the percentage of situations in which the nurses wear gloves. And the intervention, we can see the phase line there. After the intervention is supervisors speaking to the nurses about wearing these gloves. So we can see that for each of these nurses, this would be multiple baseline across subjects because we've got multiple participants. Multiple baseline across behaviors, the example provided in our textbook is for an adolescent. We've got 4 different social skills that we're targeting through the intervention, a teaching program. And by the way, we can see after the phase line that all of the skills appear to be increasing really fairly significantly through the intervention, after the intervention, which is the teaching. Multiple baseline across settings is the 3rd type, and that would be 2 different settings we're measuring for the same person, same behavior. So for this person, it's morning and afternoon sessions. So we've got the AM and the PM, and we're determining whether the same intervention is working in either of those settings or in both of them. Another type to look at would be alternating treatments for behavioral data graphing. So we've got baseline and treatment kind of on and off. For instance, this person's aggressive behaviors are being measured based on whether they watch violent cartoons or not. So we can see on day 1 they did, and the rate is high, and then on day 2 they did not, and the rate is lower. Day 3 they did, and the rate is back up again. So we see pulling back this treatment or this variable, which would be the violent cartoon watching, and then putting it in again. So it's kind of a back and forth there, one and then the other. Changing criterion design is a little bit more complex. Basically, we're looking at a baseline as well as treatment phase. And within the treatment, we're specifying performance criteria. So, we have these bars that we're looking for the person to meet. And then based on the treatment in each phase, we're wondering, are we decreasing the problem behavior at the rate that we have set goals to decrease it? So for this example in the textbook, it's caffeine consumption. The criterion is set and then it is reduced for every single treatment phase. And then we're graphing to see, is the person's use of the caffeine decreasing along with the lower goals that have been set each phase. So keep in mind, all of these are important types of behavioral graphing strategies and tools that will be used. You may need to use these for yourself, for others, for your work in the future, and you may need to be able to explain them. You'll definitely be needing to interpret them in this course at times, and so this is something that it's important to review. Be sure to be checking in with your textbook and assigned reading as well to make sure that these are all clear. And please reach out, as always, with any questions or comments. God bless you.